Today we're diving into craniosynostosis. This esoterically named condition might sound rare, but it's actually more common than people think. This talk is important whether or not you're a surgeon, medical student, or a concerned parent. Understanding craniosynostosis can make all the difference in a child's life, and in the next few minutes, I'll explain why. Let's start with the anatomy. A newborn's skull is made up of several bones: the frontal bone at the forehead, the parietal bones at the top and sides, and the occipital bone at the back, and the temporal bones near the ears. These bones aren't fully fused at birth. Instead, they are connected by fibrous joints called cranial sutures, which allow the skull to expand as the brain grows. The key sutures are the sagittal suture, which runs along the midline, separating the two parietal bones; the coronal suture, which runs across the top of the skull from ear to ear, separating the frontal bone from the parietal bones; the metopic suture, which runs down the middle of the forehead, separating the two halves of the frontal bone; the lambdoid sutures, which are at the back of the skull, separating the occipital bone from the parietal bones. Normally, these sutures stay open during infancy, allowing the brain and skull to grow together. But in craniosynostosis, one or more of these sutures fuse too early, and this is a big problem. Craniosynostosis affects approximately 1 in 2,000 to 2,500 live births globally, making it a relatively common condition among congenital craniofacial anomalies. The most common form is sagittal synostosis, accounting for nearly 50% of cases. If left untreated, craniosynostosis can result in an abnormal head shape, increased intracranial pressure, developmental delays, and other neurologic complications. There are different types of craniosynostosis, each defined by which suture closes first. Let's run through some common ones. First is sagittal synostosis. The sagittal suture is most commonly affected, and as we said before, it runs from the front to the back of the skull. When this suture fuses early, the skull can't widen as it should, so it grows longer and narrower instead. This is called scaphocephaly. Then we have coronal synostosis. Here, either one or both of the coronal sutures are involved. These sutures run from the temples to the top of the skull, separating the frontal bone from the parietal bones. In unilateral coronal synostosis, where only one side is fused, you'll see flattening of the forehead and brow on the affected side, what we call anterior plagiocephaly. If both coronal sutures fuse prematurely, the skull becomes shorter from the front to the back and wider side to side. This is known as brachycephaly. Metopic synostosis. In this type, the metopic suture, which runs from the top of the nose to the upper forehead, fuses early. This results in a triangular-shaped forehead, a condition known as trigonocephaly. It gives the forehead a pointed, ridged appearance and can cause hypotelorism, where the eyes appear closer together than normal. Lambdoid synostosis. This is a less common type, where the lambdoid suture, located at the back of the skull, fuses. It can be mistaken for positional plagiocephaly, but it leads to characteristic flattening of the back of the skull and a downward tilt of the ear on the affected side. Now on to diagnosis. The earlier we catch craniosynostosis, the better. During routine checkups, doctors will feel along the sutures for any ridges which could signal premature fusion. Parents often notice asymmetries in the head shape first, which is a crucial clue. Clinicians should also examine the face for asymmetry, as craniosynostosis can affect not only the shape of the head, but also alignment of the facial features. For instance, unilateral coronal synostosis can cause the orbit of the affected side to be higher than normal, leading to a condition known as orbital dystopia. Imaging is key. A CT scan is the gold standard, providing a detailed view of the sutures and bones of the skull. This allows us to confirm which sutures are fused and to plan surgical intervention. Sometimes 3D reconstructions of the skull from these scans can give us a clearer picture of the deformity and the best surgical approach. So, what can we do about it? The good news is craniosynostosis is treatable and surgery is highly effective, especially if done early. The goal of surgery is to release the fused suture and to reshape the skull and allow the brain to grow normally. The two main surgical approaches are open cranial vault reconstruction. This traditional method involves reshaping the skull by removing parts of the bone and repositioning them. It's a more invasive procedure, but allows for more comprehensive reshaping. Next is endoscopic surgery. This is a less invasive option and is often performed within the first few months of life. Using small incisions, we remove the fused suture through a thin camera. Following the procedure, the child typically wears a helmet to help mold the skull into the correct shape as it heals. The timing of surgery is crucial. Ideally, we operate within the first year of life, when the brain is growing rapidly. Early surgery not only improves cosmetic outcomes, but it also reduces the risks of complications due to increased intracranial pressure. But beyond the technical details, let's talk about why public awareness matters. Craniosynostosis is often underdiagnosed or recognized too late, especially in communities where access to specialized pediatric neurosurgical care is limited. The earlier it is identified, the better the outcome for the child. Parents need to understand that unusual head shapes should be taken seriously, and healthcare providers, particularly in primary care, need to be vigilant during routine exams. When in doubt, always refer the child for further evaluation. Timely diagnosis can prevent more serious problems down the road. So to sum it up, craniosynostosis is a condition where early recognition and intervention can completely change a child's future. Understanding their anatomy, knowing the signs, and acting quickly are crucial for all healthcare professionals. And for parents, if you notice something unusual, don't hesitate to ask your pediatrician and look for the nearest neurosurgeon and get it checked out. Thank you for listening and have a blessed day.